Welcome to GDOH Health Information System, SAP ISH Med Clinical Module. In this video, we're going to touch on creating and executing a nursing cycle. To create a nursing cycle, we need to come under the particular word in the work environment dash nurses. We click on occupancy, and when we're in occupancy, we highlight the patient. Once I've highlighted the patient, we click on the nursing plan. And we go on to the nursing plan, we'll see that there is a nursing plan that has been created. So now, after the nursing plan has been created, we then need to create the nursing cycle. So to create a nursing cycle, we right-click on the item that we want to create a nursing cycle for. Then a pop-up menu will appear. Then we go and select the cycle. And once we select the cycle, sub-menu appears, and then we click on create. Once we've clicked on create, then we've got the standard cycles that are there. Then from the standard cycles, we can then be able to select which cycle we want. So for instance, I want this 4-hourly cycle. So I select the 4-hourly cycle, then I click on the green tick. Once I've clicked on the green tick, then it will notify me that the cycle has been created. And now I have a 4-hourly cycle. So from here, all I need to click on save so that we can save the data. Once we have saved, all we need to do is to go back now to the work environment, clinical work environment. Under the clinical work environment, click on occupancy, highlight the patient first. The reason we are highlighting the patient first is so that when we go to the nursing care pending perform, which is where we're going to execute our nursing plan, we'll only be able to see the nursing plans that are for that particular patient only. If we don't highlight the patient, it will mean that when we go to the nursing care pending perform, we'll all be seeing all the patients' nursing care plans. So after highlighting, I click on nursing care pending perform, then I'll be able to see the nursing cycle that I've created. And as you can see, starting from midnight up until 8 in the evening, and it's in cycles of 4 hours. So now, if I want to perform one particular cycle, let's say at midnight, there's a cycle that I've performed, and I want to record it in the system. I highlight it, and when I've highlighted it, I click on Perform Service button. When I click on Perform Service button, it pops up this window. When I popped up this window, if that particular item I've performed it, let's say 12:15, then I put 12:15 as the actual time. Then the duration that I took to perform, I put the duration, let's say I took 5 minutes. Once I've done this, you'll find that when I click on the green tick to continue, this particular cycle will be removed from here and it will go into nursing care plan performed. So if I click on the green tick, it now disappears. I'm only left with the cycles from 4 o'clock in the morning. Then if I go to nursing care performed, cancelled, then if I come here, it will give me all the nursing plans that have been cancelled and performed. How we see that? You see that here, the one that we have said we have performed, we performed it at 12:15 as actual time, and the planned time was at 12. The duration we took was 5 minutes. And if we come here on the status, you see that the one written PF, that is performed service, and the one that is written CL, those are the cancelled service. And under CR, which is the cancellation reason, this is where we see why these ones were cancelled. So that's how we are able to create a cycle and then execute or perform that particular cycle. See you in the next video.